Mhm.
All right, everyone. Good afternoon. My name is Janelle McGregor. Thank you all for joining us for our fifth and final episode in this series of Real Talk on Rona. This five-part series is brought to you by the City of Tampa, Tampa Family Health Centers, the Florida Department of Health, and Hillsborough County. I'm here once again with my great co-host, Melissa Garita, the Marketing Director for Tampa Family Health Centers. We have two guest speakers here in the Real Talk on Rona studio today, folks, and Melissa is going to introduce us to them. We are so fortunate to have with us today Dr. Monica Ryder and Dr. Ashley McPhie. They're going to give us some insight on what we need to do to stay safe and healthy as communities begin to reopen. All right, Melissa, take it from here.
Thank you, Janelle. I can't believe this is the last one of the COVID-19 webinar series. Over the last week and a half, we've heard from the experts on the risks of COVID-19, how COVID-19 can affect kids, those with chronic conditions, tips to evaluate your child's mental health, and now health and wellness after COVID-19. As we wrap up the last of the Real Talk on Rona webinars, I would like to thank you, Janelle, City of Tampa, Florida Department of Health, Hillsborough County, and of course, our Tampa Family Health Centers webinar speakers, Dr. Ryder, Dr. McPhie, and Ms. Reed. These webinars would not be possible without them. These webinars have been a great outlet to share important information with the community, and I appreciate being part of this initiative. For a quick introduction of Dr. Ryder and Dr. McPhie, I would like to start with Dr. Monica Ryder. She was born in rural Northeast Arkansas, and at an early age, she recognized the limited availability of medical services in the area, and by the age of 6, she decided to become a physician. Dr. Ryder is a Xavier University of Louisiana graduate and went on to receive her master's in public health with a concentration in maternal and child health from the University of Alabama, Birmingham. With an unwavering determination to practice community medicine based on her childhood and educational experiences, Dr. Ryder went on to medical school at Nova Southeastern University College of Osteopathic Medicine in Fort Lauderdale, Florida. Upon completion of residency, Dr. Ryder immediately went to work in community medicine at Tampa Family Health Centers as a primary care physician. Since 2013, Dr. Ryder has been a physician champion for multiple centers within the organization, providing mentorship and guidance, which ultimately led her to her current role as Chief Medical Officer for the organization. Today, she works tirelessly to advance the quality of care that is provided to a population greatly in need of services. Dr. Ashley McPhie was born in Ocean Springs, Mississippi. Due to an early interest in caring for people, Dr. McPhie completed her undergraduate training at Xavier University of Louisiana and went on to attend medical school at the University of Mississippi to develop her career in becoming a physician. In 2011, she moved to Gainesville to complete her pediatric residency at the University of Florida. Dr. McPhie has always had a passion for community health, and in 2014, she relocated to Tampa and joined Tampa Family Health Centers as a pediatric provider to start addressing the growing healthcare needs in the Tampa community. She served the community in that capacity until 2018, when she was promoted to Director of Pediatrics. It is in this role that she has been able to support Tampa Family's mission to provide quality, caring, and accessible health care to a culturally diverse community for the children and adolescents of Hillsborough County. I am pleased to introduce both Dr. Monica Ryder, Chief Medical Officer, and Dr. Ashley McPhie, Director of Pediatrics. Dr. Ryder?
Thank you so much for that great introduction. And again, thank you to the City of Tampa and Hillsborough County and the Florida Department of Health for even allowing us this opportunity to share some information with the community. So we'll just kick things off with this health and wellness after COVID-19. So just a quick reminder, what is the coronavirus? Again, it is a family of viruses that can cause illnesses in animals and in humans. The symptoms can range from mild to severe, mild being more of like a cough, maybe a runny nose and a low-grade fever. Severe can go as far as symptoms like pneumonia requiring hospitalization. Your doctor can determine whether or not you can rest at home or if you need specialized care within a hospital or /ICU. So, health and wellness after COVID-19, understanding Florida's phase one. So we know that our Governor DeSantis did lay out his plan for the state of Florida to advance beyond our current state within COVID-19. So we'll just explain some of the steps and see how each of these steps relates to you and your health and wellness. So the first things first, schools are still using distance learning. So parents, buckle up. You got another 4 weeks. It's almost over. We can see the finish line, but yes, we are still using distance learning. And I hope you all were able to tune in to the very wonderful webinar that was hosted by Ms. Reed in regards to mental wellness. And a lot of parents and students are dealing with the anxiety of not being able to go back to school and the pressure of not being able to see their friends and having to be cooped up at home. And this unfortunate school staying closed and doing the distance learning is going to have a significant effect on our children and the parents and the teachers. So if you have the time, please go back to that webinar and listen to some of the great words of wisdom from Ms. Kristen Reed. Visits to senior living facilities are prohibited. Yes, we do want to see our loved ones. We want to go visit with our family members, but at this time, it is just not feasible, and it's just not safe. We want to do everything that we can to protect that vulnerable population. Senior living facilities includes assisted living facilities, or ALFs, or nursing homes. So you just want to be mindful that right now it's for the protection of those patients, the caregivers within the facility, the nursing staff, the providers, but also you. Elective surgeries can resume. I know that many patients were very excited when they did hear that part of the plan to go ahead and move forward with phase one and with Florida, but we ask that you be judicious. If this is a procedure that you can put off maybe for another month, please do so. Please allow those surgical centers and hospitals and providers to take care of those patients that are still in need of emergent surgeries that they just weren't able to get taken care of during this time. But elective surgeries, we ask that you first call your provider. Make sure that the availability is there. Check on any policies or procedures that they might have with screening patients before you enter into the facilities. Restaurants may offer outdoor seating with 6-foot space between tables and indoor seating at 25% capacity. Yes, we are excited to get back to our favorite restaurant and get back to some of that great Cuban food in West Tampa, but we need to be mindful. Please, please, please maintain that 6-foot distance between people. Make sure if you are having any symptoms, a low-grade fever, a cough, or you're just not kind of feeling well, you're feeling kind of achy, just don't go. The delivery services are still functioning. You can still use any of those organizations to bring you food to your home or even do curbside pickup. Retail can operate at 25% of indoor capacity. We ask that you be judicious with this as well. If you don't need it, don't go get it. Just take your time in re-entering into the world. People are still positive for coronavirus or COVID-19, but are asymptomatic. You don't want to unnecessarily expose yourself, nor children or people in your home. No change of bars, gyms, and personal services such as hairdressers at this time, meaning the bars, the gyms, and the personal services, the hair salon, the barbershop, it's still going to be closed because of the close proximity that unfortunately that's what occurs in those types of facilities. Vulnerable individuals should avoid close contact with people outside of the home. Yes, we are given a bit more freedom. The Safer at Home is going to be lifted effective Monday. You still need to be mindful. Again, asymptomatic patients can be positive. So do your best to maintain a bit of distance between yourself and anybody near you. All individuals, when in public, should maximize physical distance. Avoid socializing in groups of more than 10 people in circumstances that do not really allow for physical distancing. This refers to the barbecues at home or the block parties that you want to go to, or some of the birthday parties that some of our children have unfortunately not been able to have. Still be mindful that more than 10 people still places you at risk. And even amongst those 10 people, you need to do your best to socially distance yourself. Face masks are recommended for all those in face-to-face interactions and where you cannot social distance, meaning there are some people who, for whatever reason, they do need to fly somewhere, they need to get on an airplane. please make sure you're wearing a mask. It is not mandatory for all of the airlines, but quite a few have moved in that direction. If you are going to be in a space where you need to stand in line and you're waiting on something and they don't have the floors clearly marked with the 6 feet in between each spot, please wear your mask. You just don't want to do anything that can increase your risk of contracting the virus. So Florida's next steps. There is no definitive indicator. There is no one thing that's going to tell us, yes, we can move on from phase 1 to phase 2 and so on and so forth. Again, the governor has set forth his safe, smart, step-by-step plan, which I encourage all of you all to take a look at. You can go to florida.gov to take a look. But the state, some of the key metrics that they will be using to consider whether or not we move forward, the state needs to maintain health benchmarks of the plan and maintain hospital bed capacity, meaning it is very, very unfortunate what is happening and what has happened in New York. The virus, unfortunately, too many people did get sick very quickly. It overwhelmed the health system. So luckily, we have the infrastructure in place right now, and we have great legislative plans in place to monitor that. So we have to make sure that our hospital bed capacity can handle the number of patients that could potentially get sick from the virus. We will all be monitoring COVID-19 test positive rates. So we are going to make sure that we truly are trending down or plateauing. But if we do see that number start to go up, then of course you will start to see certain measures in place. We may have to phase back the current step that we're at. And of course, the success of phase 1 will dictate whether or not we move on to phase 2. And with that, I hand it off to Dr. Ashley McPhie.
Thank you, Dr. Ryder. So Dr. Ryder touched on many important points and things to remember going forward. I wanted to take a second and speak specifically about your children. As we do begin to reopen Florida, when it comes to our kids, I want everyone to remember that the same rules apply. So Corona is not going away. We are learning the best ways to live with it. And Dr. Ryder touched a lot on those points of how do we live with this. I know that kids don't always follow rules. I mean, of course not their kids, especially those teenagers who feel I'm healthy. Why does this matter to me? Mom and or dad are just being dramatic. So-and-so celebrity on Instagram or whatever social media platform said everything is good, so I don't get it. This is when talking to your children and having that conversation that Ms. Reed, our behavioral health specialist, alluded to, is super, super important. And I want you to remember these basics. So sticking to the basics, stay home whenever possible. So Dr. Ryder had also said, if you don't have to go, don't go. So you've heard these things a million times. Your favorite establishments, they're not leaving. They're just modifying the way that they do things. And you do have options. Again, there's takeout, there's curbside pickup. Keep those kids at home when you're running errands. If you have to go out to the grocery store, don't bring all the children with you. Again, they don't understand the concept of social distancing. They want to touch. They want to interact. So try your best to please, please keep them at home. And then wash your hands often, 20 seconds, and use alcohol-based hand sanitizers. When you're going out, when you're coming in, make those changes in your home, those basic hygiene things that we should be practicing anyway on a daily basis. And then stay away from anyone who is sick. So obvious cough, fever, chills, these people shouldn't be going out, but you have to take that extra step of precaution to make sure that you're being safe as well. And on my live talk, I said, play it safe. So I want you to keep playing it safe. Avoid play dates. Kids getting together do not know how to social distance. It's not the time to go running right back to those things just now. Parks, they are currently closed, but as we look to the future, they're going to reopen. So understand that infection control measures for public places are going to be difficult to monitor and really hard to enforce. So stick to parks close to home. Bring your hand sanitizer with you and wipes, and wash your hands often when you do get back to these places, but it's always, always going to be safer at home. Trips and traveling should still be postponed, especially if it's to see grandparents, older members of the family. those vulnerable populations, it's not time to go right back to those things. And then daycare. People are going to be going back to work. So I want you to speak with your daycare centers and discuss what protocols they have in place to keep your children safe. Ask about alterations to pick up and drop off procedures. Ask about how they monitor for symptoms, who they're allowing back and who they're not, and ask about their cleaning procedures. And then I want you to keep limiting those social gatherings. Dr. Ryder alluded to this as well, but I want to focus on your teenagers. Again, this is a population that doesn't understand why they can't hang out and spend time with their friends. They miss their friends. They miss their friend groups. It's a part of their identities. It's a part of who they are. And they are missing these huge milestones at school, and the future seems different for them, and it seems very unsure. Ms. Reed stated yesterday that communication is important. Acknowledge their feelings, acknowledge these new stressors, and put it in terms they can understand. Make it real for them. Explain to them how they can keep their grandmother safe and how important that job is. And with a sense of responsibility to the family, with giving them a job, it gives them a reason to better adhere to these rules and standards, and it gives them a goal. And that's really important for teenagers. And lastly, I want you guys to stay active. This goes for any person, for any health condition. Keeping your lungs open, keeping yourself healthy, always keeps you healthy. But do those family activities together, ride bikes, go on a walk, do nature trails, nature hunts outside in the backyard, and help them prepare for things that they may be looking forward to in the future. So if your son wants to play football, if your daughter's going to try out for basketball, help them work on those skills. Get outside, work on those drills so they're ready to go and they're ready for those tryouts and practices when the season is allowed to resume. And with that, I'm going to talk about Tampa Family Health next steps along with Dr. Ryder. I'm actually going to toss it to her and let her tell you about a few of these things that we're doing at Tampa Family to push forward and let you know we're still here and how we're going to keep you safe.
So, yes, we encourage you to stay home, as you know, Dr. McPhie and I have both stated, but we really want you to call your primary care provider. That's what we're doing here at Tampa Family Health Centers. Call us first. Let's make sure that you are asymptomatic. We're going to go through the CDC checklist to make sure that you don't have symptoms, or if you do, we can take care of you via telehealth. But call your primary care prior to just walking in. Schedule an appointment. Make sure that you are up to date on all of your information. If you need any medications or referrals or things of that nature, call first. Again, the social distancing is what we're practicing here at Tampa Family. We do have our chairs spaced out appropriately. We have special stickers on the floor to mark where people should stand to make sure they're 6 feet apart, and we actually will keep that for quite some time until we truly see that the virus is starting to decrease in the number of patients that are testing positive for it. Hygiene is forever, though. We really, really, really hope that this whole COVID unfortunate experience was eye-opening. We really hope that you understand how often you really need to be washing your hands. And when you're not able to wash your hands, we hope that you're now going to just make it a part of your common practice to carry hand sanitizer around. Here at Tampa Family Health Centers, we do have telehealth services, and through telehealth, we can offer medical, dental, and behavioral health. Again, you just give us a call, 813-397-5300, and we have some well-educated call center specialists that can guide you to the right provider to provide you the services that you need. If you are not a Tampa Family Health Centers patient and you don't have a primary care provider, of course, we would love to have you a part of our family, but if you do have a primary care provider, call them as well. They might also be offering telehealth visits, and they too might be trying to limit the foot traffic within their center to try to decrease the spread of the virus.
And pediatric well visits and immunizations are still happening. We're really pushing for those children birth to 24 months to get those vaccines in, and that's at recommendations from the CDC and the American Academy of Pediatrics. We have designated one of our centers to be our center where we do our well visits and push our immunizations. So give us a call at that number and let us help you stay safe.
So Tampa Family is committed to keeping our staff, our patients, and community healthy, and are continuously following the guidance provided by the Florida Department of Health, the CDC, the United States Department, and the WHO and OSHA. So we are making sure that we are only using products that have been approved by those governing agencies and the EPA to keep all of our facilities clean and sanitary. Okay, so questions? All right, so now we're ready to open it up to any questions or comments or concerns you might have regarding health and wellness after COVID-19.
All right. Thank you all so very much. We have quite a few listeners here today, and they definitely have some questions. Our first question is going to be, how can someone schedule a telehealth appointment?
Okay, so great question. For Tampa Family Health Centers, all you have to do is call our main line. It connects you directly to our call center, and the call center staff has been equipped with the proper information to direct you to the right provider, be it adult medicine, pediatric, behavioral health, or dental. And our phone number again is 813-397-5300.
Now, can someone use telehealth what can someone use telehealth to be seen for?
For Tampa Family Health Centers, you can use telehealth visits to, say, follow up from a hospital visit. It's like a consult with your medical provider. We can also refill medications, submit referrals to a specialist if necessary. Some offices do have remote monitoring. They have the ability to have the patient check their blood pressure or their sugar, their weight at home, and that information can be inputted into the system. So there are a plethora of things that can be provided via telehealth. If you are a Medicare patient, we can do your home risk assessment. We can do some annual wellness visit information, do some screenings for you. There's quite a bit that can be offered via telehealth. If you are a Tampa Family Health Center patient, you just call us up and we can give you further information. If you're not Tampa Family, of course, call your PCP, and I'm sure they have a list of things, services that they can provide.
Thank you. Now, let's say someone does have to come in to one of the health centers. What can they expect as far as how Tampa Family Health Centers is going to keep them safe during their visit?
Yes, so as we talked about before, we have implemented several social distancing policies and procedures to keep our patients and our families safe. So one of those are the stickers that you will see on the floor that mark 6 foot from the front desk and keep the patients 6 foot apart. We have instituted spacing in our lobbies for the chairs to keep our patients apart. And then on the pediatric side, we have changed the appointment types and visits to have our well visits in the mornings and our urgent or sick visits in the afternoons.
Thank you. Now we have another listener who is asking whether or not daycare is going to be safe for their child.
So as I alluded to previously, we can't explicitly say whether your daycare will be safe or not, but what I want to do is empower you to look into it. ask those really important questions that I talked about earlier. Ask about all the safety measures and the cleaning protocols and how many children will be allowed back. How are they functioning? These are questions that you should be asking and getting good answers to. And if you're not satisfied with how your daycare is operating, then there are several other options in the county that you could look into. So just make sure that your family and your children are safe.
Thank you. Now, Dr. McPhie, what about parents who have children who need their vaccinations, but they're nervous about getting COVID-19?
These are valid concerns, right? So Dr. Ryder said there are patients who are asymptomatic who are carrying the virus, and that's why it's important that we keep up these safety measures. So washing hands, using hand sanitizer, contacting your PCP, whether that be Tampa Family or private PCP, and saying, what are the things that you've done to help keep me safe? And so with the question I answered earlier, I talked about all those things that we here at Tampa Family are doing to keep you safe. The vaccinations are important. I cannot stress that enough. We do not want your child getting sick with something else while we're in the middle of this pandemic. So we want you to come in. We want you to get those vaccines, and we want to keep you healthy.
Thank you. And we have another parent out there who is trying to figure out, what do you foresee? How do you foresee this pandemic impacting the beginning of the school year in August?
So that is a very good question. As a parent of children in the school system myself, I have asked that question. And that remains to be seen. We will be looking to the governor and the legislation to make some decisions regarding how and when and if the schools will open. I do know, again, COVID-19 has taught us all a lesson. We probably can all expect that our children will be engaging in different behaviors when they go back to school. They will be encouraged to maybe wash their hands more. You might see more hand sanitizer stations around the school. There might be more encouragement of social distancing within the classroom, moving the desks further apart, making sure maybe cafeterias aren't as full. But these are things that remain to be seen. We are still learning so much from this virus, and we're learning so much about human behavior because of this virus. And we just have to wait and see what our leadership decides to do with the school system.
Now, there's been a lot of talk about a second quote unquote wave of COVID-19. Do you think there will be a second wave? And if so, when do you anticipate this happening?
Based on what we have been learning about the virus, there most likely will be a second wave. They are looking at late summer, early fall. What will happen with that second wave all depends on the lessons that we learned. How we react to the virus the second time around will depend on us saying, oh, I remember last time if we had sheltered in place a little bit sooner, we might have been out of this quarantine a little bit sooner. If we had been washing hands appropriately more often or using sanitizer more often, the virus might not have affected so many people. So will it hit again? Yes, most likely, but it's on us to determine the significant effect on the population.
Thank you so much. And lastly, is it better to continue to work from home despite the state reopening?
I think it depends on what your office setup is. Some people can come back to work if they are in their own separate space, if they're in their own private space. But if you're in an office space or you're sharing one big room and you're within 6 feet of each other, it might be safer to just stay at home. But if you have the luxury of returning back to work and be in a space where you're not going to be in close proximity to anybody, it is okay to return to work, but using proper hygiene and doing your best to avoid close contact with too many people.
All right, I know I said that question was our last one, but we just had another one that came in from a parent who is asking whether or not you would recommend using telehealth visits for pediatric patients, since kids can't oftentimes describe what their symptoms are?
Absolutely, I recommend using telehealth. Tampa Family has a pediatric provider on telehealth. We have this service in place for our established patients. As Dr. Ryder has said, if you are a Tampa Family patient, great. If not, we'd love to have you join our family. So we do push those visits where we can to get those pediatric patients on telehealth. So I encourage them to contact us. I encourage them to contact their PCP and see if they have telehealth visits available.
Thank you so very much. Thank you, Dr. Ryder and Dr. McPhie, for giving us this invaluable insight from the health and wellness perspective of what we still need to do as individuals and as a community to protect ourselves from COVID-19. We appreciate what you both are doing, along with the Tampa Family Health Centers staff, to keep us all informed and healthy. Now, you may be hearing a lot about reopening the state and our local communities, but we must remember that the Rona is still real, folks. And just because you don't have symptoms or maybe experiencing mild symptoms doesn't mean that you aren't carrying this potentially fatal virus. So we still need you to get out there and to get tested. Hillsborough County is operating 2 drive-through/walk-up testing sites, one at Raymond James Stadium, and there's also a site at the Lee Davis Community Center. You don't need insurance. The test is free. All you need to do is call 813-272-5900 to make an appointment. Make sure you call and set an appointment, folks, so you know what day the testing sites are open, as they are not open Monday through Friday. So we definitely encourage you, call 813-272-5900, make that appointment, and make sure you make it to the appointment as well. We will get through this together, folks. We thank you all so very much for joining us today. Replays of Real Talk on Rona will be available on May 4th for those of you who may have missed the session or just want to go back and listen to these informative episodes again. Thanks again to our doctors and healthcare specialists at Tampa Family Health Centers, along with our partners at the Florida Department of Health and Hillsborough County government, for helping us to make Real Talk on Rona possible. Stay calm, stay safe, stay informed. This includes this series of Real Talk on Rona.